Now, from the station you count on for local news that matters, this is KARK4 News at 5.
Open heart surgery was the only option for patients with a specific heart condition, but now there's a treatment that's minimally invasive. Because health matters, KARK4 Suzanne Bruner shows us how this new procedure saved one woman's life.
All it took was for someone to notice Reba Graham's shortness of breath.
I took about 10 steps and down I went.
The 75-year-old didn't realize how bad it was. Doctors found Reba had mitral regurgitation, a heart condition. It's caused by a leaky heart valve.
I shouldn't even be here, I guess. But I am.
She credits Mitraclip, a new procedure at Baptist Health that uses a catheter to repair the leak in the heart valve with a clip. Reba was a high-risk patient for the traditional open heart surgery. Mitraclip just may have saved her life.
I think at Baptist we're trying to stay ahead of all the innovations that are out there.
Dr. Ernesto Ruiz Rodriguez says new research compared patients who treated mitral regurgitation with medicine to those who underwent Mitraclip and took medicine at the same time. Well, it found patients who got the procedure and took medicine did better.
They live longer, they have better quality of lives, and they actually stay out of the hospital for longer.
Today,
I feel okay when I walk.
Yeah.
Reba doesn't have to take too many breaks while running around town.
I'm going to Walmart, walking around with a buggy, and I'll drive to town 10 miles and 10 miles home, go get my hair fixed.
What she thought felt normal shocks her now.
Watch your signs. You know your body.
Knowing Mitraclip has allowed Reba to feel a huge difference in her quality of life. In Little Rock, I'm Suzanne Bruner.
And Baptist Health is one of 2 centers in Arkansas that offers the Mitraclip procedure.